Good afternoon and welcome to the Digital Desk. I'm your host, Sarah Good. Today we're going to be talking about a program that is on the peninsula, Project Lead. Now we have the population health manager with us today, Tess Ledoux, who's going to talk to us about what this program is, how it's leading change on the peninsula and bringing awareness. This week was Fentanyl Awareness Day on Tuesday, and that was a day where at Wavy and across the area, resources have come out to share, where you can find help, also to bring awareness to the opioid and, epidemic that is happening in our community, but also nationwide. So I just want to bring on Tess and we'll get started. Tess, thanks so much for joining us this afternoon.
Hi, thank you for having me.
Absolutely. To get started, I think there are so many resources in our community, which is great. But Project Lead is one of the newer ones that's on the peninsula in Newport News and Hampton. Can you just give us a brief, overview of just what Project Lead is, and then we'll get into some of the practices?
Sure, yeah. So Project Lead got started back in January of 2023, so we're a little over a year old now. And it is the Hampton and Peninsula Health District's first substance use and opioid response program. So what I think is really interesting about Project Lead is that we kind of have a front-facing program, which is for our community, and then services that we really work on with our community partners. Because just like you said, we have a lot of organizations in our area that focus on, substance use, mental and behavioral health services, social needs services. But, not all of them know exactly who they are, what they do. Our community certainly doesn't know about all of these organizations and the great resources that they provide. And so, our goal and our effort is to ultimately reduce overdose deaths, both by helping our community directly, but then working with those organizations so that we're all kind of speaking the same language, sharing data, making sure that everybody's trained in trauma-informed care and stigma reduction, things like that, that go a long way and make an effort in reducing overdose deaths.
And we'll get into some of that partnering organizations, which is great, to use sort of organizations that already exist and frameworks that you all have on the peninsula to help people. I want to start by something that it says online, at least. It talks about a number of opioid overdose deaths that have happened in the community in the peninsula. How does that compare to the state, and why is it such a big problem that you all want to bring awareness to it and have a specific organization to address it?
Yeah, so, specifically in, two of our localities in the cities of Hampton and Newport News, both have higher overdose death rates than the Commonwealth of Virginia as a whole. And not to say that those localities aren't doing tremendous work as well to try and reduce those deaths that we're seeing. It's truly a joint and community effort that we're all playing a part and a role in to reduce overdose deaths. But I think why it's so important is because, we've seen this spike and we're working to reduce them. And there's certain other reasons for why that might be, but we've seen mental and behavioral health issues and concerns that have been exacerbated, from the COVID-19 epidemic, and working to really connect people to, social needs services. We want to meet people where they are, and whether that is to help them into recovery, then that's great. Whether that's just connecting individuals to, maybe food and housing services or gas and rent assistance, that's great too. Anything that we can do to really help people take control of their lives again and get the help that they really need is why we're doing this.
And I want to start by going through Project Lead. When you hear it, obviously, leading change in the peninsula, but it also does have something that it stands for. Can we go
Yeah.
through those four practices that are, part of the organization's mission?
Yeah, absolutely. So Project Lead, it stands for linkages, education, awareness, and data. So as it pertains to linkages, sort of what I alluded to earlier is that we work to connect individuals to critical care services. That can be anywhere from, treatment and recovery centers. It can be therapy. It can be food and housing stability organizations. Maybe somebody needs access to, rent assistance. and we can connect them to that. So we utilize a platform called Unite Us. It's a referral network where we're able to screen all individuals, for every service that they might need all at once, so that they don't have to go, continually back and get screened again and again and have to go through a lot of different referrals. And the onus of responsibility really falls on that organization to receive that referral, respond to that referral, and if we're not able to, then to connect them to the next agency that can then respond to that individual so that they don't fall through the cracks. And so that's why we really focus on linkages and both connecting community organizations to the platform, but then also screening individuals. And, if somebody wants to get screened for services, they can just go to our website. They can put in their information and we'll give them a call. But there's a lot of different organizations that are doing Unite Us within our community. So they don't have to go through the health department. They can go to other organizations and just say, hey, I really need these services. And we all use the same social needs screening form. And so it's really great. And it's a good way for us as a community and as community providers to connect individuals to care, because we're all speaking the same language as well.
And are you all seeing that linkage happen, if you will? Are you seeing people reach out either through you or through partner organizations?
Yes. Yeah. So in the last 6 months alone, we've seen over 800 clients, and a lot of them are getting connected about 2 referrals per client. So we're meeting about 2 needs per person.
And what do you think is maybe the impetus, or what do you think sort of started the need for this? Do you think people didn't know where to go, or what was the first step in sort of
Yeah.
seeking that help?
Sure, I think so. I think that it's kind of multifold. I think we had individuals who maybe lost their jobs during the pandemic. We had people who, weren't able to access certain services. There was a lot of social isolation that happened then. So we started seeing people really need mental health services and behavioral health services. And like you said, I don't know if people always knew where to go. Certainly our own community organizations and partners, we know that there's a lot of people that provide services, but we're not always aware of exactly who they are, what they do. And if we don't, as providers, then we can't expect our community to know either. So we're really trying to connect individuals, and, we have these great organizations. They want to provide services. Let's do it. Let's connect them that way. So I think that is really the impetus for this, and where we got started. But I think that we're seeing that continue throughout the past year alone. And people are very thankful, I think, that they can get everything kind of done all at once, because we're busy and life happens, and you don't always have time to go to 1,000 different doctor's appointments or different locations to get care. But through this, it's very streamlined and efficient.
Absolutely. When people are seeking help, maybe they don't exactly know the first stop. This is a great tool and resource for people in the community, especially one that is local, obviously community driven, and right there in your own neighborhood. I want to go to the second one, the education piece, the E.
Yeah.
How key is that after finding the right organization, after maybe connecting them with the right resource, but the education piece of it to understand what's happening with the opioid epidemic?
Yes, education is critical. And again, on both sides. So we work to train our community organizations and Revive, if they don't already have it, as well as trauma informed care, so that they know how to interact with clients who are experiencing struggles in life, especially with mental and behavioral health concerns. We also work with our community organizations on stigma reduction, so that we can really bring to light that there are people who use drugs and we need to support them, and that not all of our services can be catered just towards recovery, but helping and meeting people where they are as well. So we do education on that side, but then we focus a lot on education for our community. We do Revive trainings out in the community and Rapid Revive, so that you can kind of get that quick Revive training of what naloxone is, how to use it, how to recognize an overdose, and, start saving lives that way. Again, I think part of meeting people where they are is knowing that not everybody has time for a 1 hour long class, but we can always give them the tools that they need to help themselves, to help a loved one.
And how important is that distribution, do you think, of naloxone and Narcan, to have those available in the community, whether it be maybe at different pharmacies, organizations, but to have that resource?
Yeah, naloxone saturation is huge. It's game changing. Naloxone saves lives, and it's really low risk in the sense that you're not going to get addicted to naloxone. But we ultimately want people to have that on hand, whether you use, substances, whether somebody that you know or that you love use substances. I personally carry naloxone everywhere I go. I can't presume to know if somebody that I'm walking past, isn't going to overdose at that time. But if I can then step in and help them, then I will. I think naloxone and Revive is sort of similar to CPR classes, and other life-saving, trainings and certifications. There was a time where people didn't have the tools they needed to respond to somebody with a heart attack. And once that education started becoming saturated out into our community, we were able to then see a reduction in heart attack related deaths. And I think that we can do something similar with overdoses.
And we know that time is so key,
Yeah.
both with your example with the heart attack and also with overdoses. So having that right on hand is very different, say, waiting, even a few minutes, just for the EMS to get there.
Yeah, I mean, there's no guarantee that the one naloxone is going to save somebody's life. A lot of times it requires a couple doses, but you can always save somebody in that moment and give them just enough time for EMS to get there.
Absolutely. And I want to go, sorry, just to keep us moving, I want to make sure
Sure.
everyone listening and it seems one person had a question, but I think we just answered it, with some of these key steps that we're talking about. But if you have any more questions, you're on Facebook or YouTube, I'm taking a look. So please put your questions there. And I prompted it as well. The A for awareness, and that is huge this week. That's why we're here today. The awareness piece of both, substance abuse disorder, of the opioid epidemic, and then also this week with fentanyl and how that is able to be put in some of these, drugs and some of these things. I mean, how important is the awareness piece just all around here?
Yes, awareness is critical. Because if you don't have any knowledge of, substance use or overdose deaths, or even people who use drugs and understanding that it's a lot more common than you think, I think that we start to kind of put up, barriers and walls around it. And we think, well, it's not me or it's not my loved one. So it probably doesn't happen that frequently. But it does. And I think another huge part of awareness is that stigma reduction piece. The more that we have people aware of what's happening in our community, the better we can do to save people's lives. And that's really what it's about. You have to know that there are people who are struggling, and just be kind and understand that we're all in this together at the end of the day, and we're building community. So the more you're aware of what's happening and being educated on something, even like Fentanyl Awareness Day, fentanyl is in our drugs and it can ultimately require several doses of naloxone to respond to. But people don't know that unless you share that with them. So even somebody who might be educated and have naloxone on them might not understand why somebody's not responding to an overdose immediately. And so the more that we can then share that information and education, I think the better.
And that awareness piece right there that you were talking about, the beginning of that, about debunking the thought that people have that it's not going to happen to me, it's not going to happen in my circle, it's not going to happen in my family. We've done so many stories here alone that have shown just how easy it is for it to sort of creep in, even if it may be an injury, an accident, or, through social groups and friends. So it's always right there, and to not be educated because of that lack of awareness, could be a really crippling issue.
Yeah, absolutely. And you bring up a really good point, which is that, somebody could get in an accident and then it could be you. You could lose your job, and, then you starting wondering, what are my options? Or you might start struggling with mental, concerns and mental health concerns. And then, something like using a substance, it becomes a little bit more likely to you than maybe it was even a week ago. So I think we just have to really be cognizant of that and recognize that people are in very different spots in their lives.
And all of this is based off, the last letter, D, the data. So you all
Yeah.
have looked at it, you've seen it. I mean, just tell us a little bit about how you're sort of, I guess, keeping up with that and how that might be influencing things.
Sure. Yeah, we work a lot with data. We think of Project Lead as very, data informed and community driven, and it's really about community in all levels. So obviously we don't do any work without those two things, both having the data inform our work, but then also having our community inform and drive our work as well. We're really not fans of throwing something at the wall and seeing if it sticks. We want to make sure that our community is on board, that there's longevity and sustainability to the project. And that's, why we make a lot of the decisions that we do, is because, our community said that they were looking for it. As it pertains to the data, obviously we work with a lot of different agencies, whether that's, our local hospitals, our EMS providers, our local police and state police. We work with OCME data, which is the Office of Chief Medical Examiners. So we look at a lot of different data to help inform our decisions. And then from that, we work with our community partners to then collect data. So when we're all on Unite Us, we're making sure, somebody came into the Unite Us platform and they're continuing to need referrals to services. So clearly there's some sort of disconnect. Maybe they're not getting the services that they need. Maybe they're still struggling. So, we look at that as well. And, we track some of that data to say, how can we then make a difference? How can we improve or change what we're doing? We don't want to just continue our program and hope and pretend like we're going to do great things. We want to make sure that we're actually doing great things. And, I think another part of this is that we all collect different data, but if we can start collecting the same data and have some data standardization, then we start being able to measure, are we actually making an impact in the community? Is the needle actually changing, or is it staying the same?
Right, and that goes back to one of the first things we were talking about is who's using this Linkage's platform. It's like you can see that 800, plus people have utilized the system, have gone in. So it obviously is there and available, but that's interesting that you all are tracking who's going, or I should say tracking, but understand the data of how it's working. Are these referrals working? Is this community that you're building working?
Yeah, and we start to see what services people really need. We might have several organizations that provide treatment or recovery, but we may not have a lot of organizations that provide housing services.
Mm.
And what do we do about that? Can we all reconvene and say, who has the ability to provide housing? Do we need to start applying for grant funding so that we can connect people to housing services? Data really informs a lot of our work at a lot of different levels that maybe people aren't fully aware of, but we're always trying to look at it, collect it, and then, share it with our community in turn.
Absolutely. And then the last piece of it that's separate from the LEAD, but is still quite important, is that call to action that you all talk about. So that is with the Revive trainings as well. But what sorts of actions do you want the community to respond with? Obviously you want them to utilize this if they have a need, but how do you want the community to engage with you all?
Sure. So, one of the big things that we're obviously pushing is naloxone saturation out in our community. We want to give Revive. We have people itching to give Revive, actually. And, that is just from an individual that might be attending, one of our outreach events, to local businesses, organizations, our motels and hotels and our restaurants, locations where people might be overdosing in a bathroom. And we want those individuals who work there to be empowered to respond, to have that resource and say, I know what to do. And that's, a huge piece of this, is that we want to share our education and our trainings with our community. So Revive is definitely a huge piece. And then, of course, I think, another piece that is sort of a call to action, but is maybe more a call to reflection, is understanding that stigma piece that goes with this, that component of understanding and empathy towards, your fellow community member, your neighbor, and knowing that we're all going through different struggles. And as much as we can help each other and be educated ourselves, provide services, I think that's going to be what really is a game changer, is that empathy and that stigma reduction.
And I think that's something too, again, to go back to the awareness piece of this, that is so key. And obviously doing the work that you all do and getting out there and being able to share this, program with the community is a huge step in that.
Yeah, absolutely.
Well, Tess, is there anything else? I know that today is more of an overview, and there are a million partner organizations and things we really could have, also dive into. But is there
Yeah.
anything in terms of, let's say someone's watching this and just doesn't know where to start? Is it going to your website? Is that the best place to get an overview, to get information?
Sure. Yeah. Absolutely. We want people to go to our website. We have everything from QR codes where you can request a Revive training with us, and we'll come out and we'll do that for you or for your business. We have trainings on there on, substance use and stigma reduction that if you're interested in taking, we have it there for our community. And then, of course, we have things for our community organizations. So if you're a provider in the community and you're watching this and you want to partner with us and you're excited about the work that we're doing, we'd love to have you. We've grown to have over 70 organizations that work with us on Project Lead. It's a huge undertaking, and we don't do this together. We facilitate a lot of work. We elevate a lot of other organizations, great work, but it is a true joint effort.
And in terms of people that, might want to get involved in the training piece to understand how to use naloxone and all of that, is that also something where they should at least reach out to you all as the start of sort of figuring that out?
Yeah, absolutely. We have it's like an entry into our website where you can put in your name, your contact information, and a little message. So if you're just somebody that's watching this and you're like, I might have experience with this thing, or I want to volunteer. This sounds really cool. Send us a message. We would love to work with you. We can have you be a volunteer with our agency. We can have you, share whatever expertise you want to share. If you're an individual who is an active user or has experience using drugs, we want to hear from you as well. This program is for, that community. It's for people who use drugs. And we don't want to do this work without, taking that into consideration. And we want to hear your input. We want to know how we can frame our services around your needs. So, that's a huge thing for us as well.
Well, Tess, I want to highlight one thing, that you said in all of this, especially with the call to action and training and things like that, is this should be another, this is like having a CPR class or learning, first
Yeah.
aid or something. This is so key. And I think that is a big piece of reducing the stigma as well, is making this a known thing, making this maybe a part of every organization. Is that one of the goals, to sort of open that up?
Yes, yeah. So we're making Revive training a requirement for all of our staff here locally. It doesn't matter if you're just a nurse. And I shouldn't say just a nurse, but it doesn't matter if you're a nurse. It doesn't matter if you're working behind a desk and you never see any of our clients. We want you to be trained and revived so that you can respond. And we hope that your organization considers that as well. There's always a chance that somebody might experience, an overdose where you're working. And as much as we can help people, give them the education and empower them to respond, we want to do that.
And those resources are huge. You might learn them at the office, but that's something you can bring home to your own neighborhood, to your own community, to your own group.
Yeah. Yeah, we want to give everybody the resources that they need. We have kits that we partner with our different organizations and agencies on to provide to the community. We can provide naloxone and information to your local business or to you. So we have everything, so that we are giving you all the resources that you need to succeed.
Well, Tess, thank you so much again, Population Health Manager in the Peninsula. But thank you so much for joining us today to talk about this program. And for anybody that's watching now, that's watching later, if you're watching on wavy.com, you're already there at the resources. You can go right to Project Lead's website. If you're watching on Facebook or YouTube, the link to wavy.com is right there. That's going to direct you to everything Tess is talking about. That's going to direct you to the entry form and so much more information. So, Tess,
Yes,
thank you so much for joining us today.
thank you for having me. I was happy to be
Absolutely.
here.
Thank you. And absolutely. And I just want to say one last thing. If you all have questions, please also go to Project Lead to find out more. And then there's also contact information. And there you can find out more about the partner organizations as well. So thank you so much for joining us today.
Thank you.